For some already struggling to get by, healthcare access can be a serious challenge.
Little things like refilling a prescription or getting to a doctor's appointment are hurdles that can add up to an emergency.
A 2022 study from the U.S. Census Bureau found those who lack access to resources like income, insurance, and transportation are more likely to end up in the emergency room for preventive care.
In an attempt to address this, the city of Portland, Oregon partnered with a nonprofit to help those who don't necessarily face an emergency when they call 911.
Reporter Ezra Kaplan takes us along for a ride with a specialized service already making a difference.
Looks like it's an overdose. Medical's rolling.
Every time there is a medical emergency in Portland, dispatch has to decide what resources to send out. But not every 911 call requires the same level of response.
You'd be stunned what people call for. I've had people call for having a bad dream. I've had people call for tearing a toenail off. I've had people call because they couldn't sleep. So that's why a program like Chat needs to be created to take that burden off of the 911 system. Like, it doesn't make sense to send a fire engine and an ambulance to someone who had a bad dream.
Instead, Portland Fire and Rescue has a team called Chat, which stands for Community Health Assess and Treat. Deputy Fire Chief Stephanie Sullivan leads the program, which was started in 2021.
So Chat is our low acuity medical response team out of Portland Fire. They're non-sworn employees who go on calls instead of the fire department and sometimes instead of AMR. And what we do is we try to interrupt this cycle where folks are using healthcare and the emergency room system as their primary source of health care delivery.
We got the opportunity to spend the day with Chat 1 and see for ourselves what their work entails. The team received a call to respond to a shelter in Portland's old Greyhound bus station. One of the residents had fallen behind on filling her prescriptions and was struggling with the side effects of missing her medication.
We're here because we're just concerned for you, right? We want you to be happy and healthy. And
I need my meds. That's all I need is my meds.
Right, and we're here to help you navigate that. But the ER is not the best place to navigate that.
She was having a hard time, but another trip to the hospital wasn't the solution.
Okay, well, I'm going to let the ambulance go back in service, and then we're going to kind of make some phone calls right here, okay?
They ended up calling her doctor and getting her prescriptions all sorted out.
We're having one of our EMTs go ahead and pick that up, and then we're going to have it delivered to her here.
In all, the team spent about an hour with the patient.
I'd say this is like a pretty classic Chat call. So while it may take more time in the now, it's saving just so many other hours of resources.
In Oregon, each visit to the emergency room costs an average of $1,600.
It's almost $9 million in healthcare savings just since we've started. And that comes from us treating people in the field. Because we all know when you get a bill to go to the emergency room, it's not cheap.
Chat has an operating budget of $3.4 million, and they are looking to expand. But funding has been a challenge.
Right now, all of our money is just coming from grants and this one-time funding from the city.
So what does that mean for the future of the Chat program?
Well, it means that we can't expand. Right now, we have a very small team. Our Care Oregon grant was reduced, so we went from operating 7 days a week to operating 4 days a week.
And for those on the front lines, there's no shortage of work to be done. Another part of the Chat team's mission, responding to drug overdose calls. In addition to the opioid overdose reversal drug Narcan, paramedics can administer Suboxone, a drug that can minimize the effects of opioid withdrawal. The opioid response team then connects the patient to a treatment center and follows up 90 days after the initial 911 call. Reporting in Portland, Oregon, I'm Ezra Kaplan.